If you're a nurse, do you become concerned about your mental health? If you know a nurse, I know a lot of nurses, are you worried about their mental health? Hi, I'm Dr. Jim, and my topic today is mental health issues in nurses. Disclaimer, I'm not picking on nurses. I love nurses. They are the army of professional caregivers and healthcare providers across the United States and probably around the world. But they're under a lot of stress, duress. They face burnout and a lot of other issues that might eventually lead to poor mental health. So let me explain. It's not exactly news that nurses in the United States and around the world are exposed to a wide variety of risk factors associated with negative mental health outcomes and consequences. We've known this for a long time. Challenges including anxiety, depression, cognitive impairment, trauma and PTSD, burnout, and sleep difficulties affect nurses routinely. These problems become compounded by a lack of resources and social support, nurses' behavior and lifestyles, workplace bullying, violence, and shift work. They then have a negative trickle-down effect on patient safety, accuracy, and skills, as well as organizational and interpersonal outcomes that tend to be negative. Mental health in nurses is an issue we've known about for some time, but we really need to start paying attention more and do something about it on a very large scale. We are facing a nursing shortage. Nurses make up the largest group of professionals within the healthcare system. Without them, we are done. We've got nothing. They're essential in the promotion of health and prevention of illnesses and diseases. Nurses are found everywhere throughout the healthcare system and provide both primary and community healthcare services. The mental health crisis among nurses is taking a huge toll on service quality, patient safety, increased turnover, and a weakened nursing workforce. In fact, according to the International Council of Nurses, the ICN, 13 million nurses are needed right now to fill the nursing shortage worldwide. 13 million. That's a lot. What are some risk factors for mental health issues among nurses? Well, researchers examined the close relationship among several factors that impact nurse mental health, including intra- and interpersonal factors, behaviors and lifestyle, organizational, political, and environmental factors. I'd like to first address intra- and interpersonal factors that affect or might affect nurses' mental health. In terms of interpersonal factors, we're talking about genetics, demographics, personality, and physical conditions, which all contribute either positively or negatively on mental health. Positive traits like forgiveness, gratitude, and positive experiences actually act as protective factors against mental health issues among nurses. Positive workplace relationships, social support, and social activity all have protective effects on mental health. Negative risk factors, on the other hand, include high body mass index, older age, surgical history, negative interpersonal experiences, negative personality traits, and multiple physical health problems. So right there you have these personal issues that are weighing heavily on nurse mental health. What about behavioral and lifestyle? factors that affect nurses' mental health. The behavioral and lifestyle conditions, such as sleep, diet, physical activity, and behavioral habits, also play a role in the mental health of nurses. And of course, it makes sense that protective factors would include things like getting good quality sleep and moving towards, leisure, moving towards more leisurely activities, brisk and vigorous activity, regular and moderate consumption of alcohol, 2 cups of coffee every day. These are the positive things I'm talking about now. And healthy eating, including an antioxidant-rich diet, can all be very positive and protective factors against mental health problems. Risk factors, on the other hand, include poor sleep, an inflammatory diet, high fat intake, smoking, overdrinking, and little to no physical activity. So you have the good and you have the bad here. Now, those are personal and behavioral factors. What about things that are outside the nurse's control? We live in society. We live within a context. We work within organizations. We work within political structures and economies, so on and so forth, right? The big sociological picture. So what are some organizational, political, and environmental risk factors that can affect a nurse's mental health? Let's take a look at those. On the bright side, factors like having some control in the workplace, adequate job resources, and fair and inclusive leadership actually protect nurses' mental health, while negative experiences at work, shift work, high demand at the job, a lot of strain at work, a lot of stress, burnout, understaffing, the fast pace of the job, professional anxiety and worry, and needle, stick, and sharps injuries all work against the nurse's mental health. Now, what are the consequences? So we have a nurse who is dealing with a lot, and my gosh, they deal with staffing, budgets, medical complexity of patients and residents, dementia behaviors, violence, an organization to look up to, regs. I mean, all these things are going on. I really appreciate nurses, and I do wish for the best of their health and well-being, mental health and well-being in particular. But here are some consequences of mental health issues in nurses. Understanding the many risks that nurses are exposed to on a regular basis is part of the equation concerning doing something to improve this situation. Consequences of risk factors require attention as well, and are categorized very simply as physical consequences, behavioral consequences, occupational, organizational, and interpersonal consequences. Let me start by talking about physical and lifestyle consequences of nurse mental health problems. So the nurse has mental health issues. Now what can go wrong? Nurses at risk of factors associated with poor mental health can experience a wide variety of consequences to their mental health status, including elevated levels of inflammatory biomarkers, back and musculoskeletal pain, immune diseases like arthritis, rheumatoid arthritis, hypertension, heart disease, and stroke. Mental health problems can also lead to a lack of exercise, a poor diet, overwatching television, anxiety, and depression. It's almost like a trickle-down effect. It's almost like a vicious cycle effect. Occupational, organizational, and interpersonal consequences of nurse mental health problems include the following. Nurses who exhibit poor mental health are more likely to encounter workplace bullying, experience role conflict, and lack social support. Some can experience more work-family conflicts, burnout, poor job satisfaction, and greater absence due to illness. In terms of interpersonal consequences, nurses may experience a decrease in cognitive functioning, decreased attendance at religious services, insomnia, and depression. So being a nurse puts the nurse at particular vulnerability to develop mental health issues. Those mental health issues then can contribute to other co-occurring problems, including illnesses. My final thoughts about this mental health for nurses. There's a great shortage of nurses in the United States and around the world. Nurses are exposed to continual risk factors that may negatively impact their mental health, which can lead to further complications and negative consequences. It's time to take nurse mental health really seriously at very high levels. The government, state, regs, professional boards, associations, you name it, the media. And we can all move towards effective identification, prevention, and treatment of mental health problems among nurses. There you have it. I'm Dr. Jim. If you'd like to stay in touch with me, give me a shout out at my email, jim@collinslearning.com. I hope you enjoyed the video. And if you're looking for online continuing education, CEUs for your own license, check out CEU Academy, where we create fresh content every single year, very timely, important topics. And tell your colleagues who are licensed healthcare professionals as well. Follow the link below and check out ceu.academy.